So nerve repairs are very difficult, and unfortunately, the results of nerve repairs can be difficult to predict as well. So technically for me, I have a patient who's usually asleep with a regional anesthetic or a general anesthetic. What that means is that your arm is numb or your hand is numb, or a general anesthetic means obviously that you are entirely asleep. We expose the nerve through cuts in the skin, and then once we've got the nerve in front of us, we assess it for whether it is possible to repair it, and sometimes it's not, in which case we take nerve grafts. But most of the time we can stitch the ends together. The difficulty is that when we stitch the ends together, you still have to move your fingers or your wrist, and that creates tension in the repair. So the repair of the nerve itself is like connecting two 1 millimeter tubes if it's in your finger. In your wrist, it's a bit bigger and you have lots of different bits of the nerve that you can plug together. But the evidence certainly in the literature would suggest that repairing early is helpful. Repairing just the outside of the nerve is helpful. And then to a varying degree, you have to just sit and wait and see what happens. So an ideal candidate would be a fresh cut with a sharp knife, if that's at all possible, please. And then the two ends of the nerve should not be ground down or pulled apart, because that stretches the nerve. So a nice sharp incision through a clean wound in a young patient who doesn't smoke. They are the best indicators. But equally, if you are slightly older, but you've got a sharp incision and you don't smoke, your chance of success is better. But certainly from a predictive point of view, it's whether you're a smoker and your age, unfortunately. So most of the time, nerve surgery is absolutely required when that nerve does something important. Now, nerves are made up of sensory fibers coming from your fingers or your wrist to the brain to give your brain the information it needs. And then the other half of the nerve are the motor fibers that supply the muscles in and around your hand and wrist to do the things you need to do. Now, if you've cut part of the nerve, but it's an important part, like the nerves to your base of your thumb, for example, then that's absolutely critical, because your thumb is what sets us apart from most other animals. So if you haven't got your thumb muscles, your thumb is useless, it becomes a paperweight, and that's obviously not ideal. So anything where the nerve supplies something important or takes important information to the brain is critical. There is some literature, and we're doing a study now with the British Society of Surgery of the Hand as to whether we have to repair nerves in the fingers. You have two nerves to each finger, one to each side of each finger. And if you just damage one side, the other side will to some degree compensate, and you can end up with good functional results, but without having to repair the second nerve. The other important place on your hand is this border of the little finger, because you feel along there quite often, and the other one is your index finger. So this border of your index finger is incredibly important as well. So we would preferentially repair this nerve and this nerve, or anything to your thumb, but the rest in between, less important, should we say. So the risks with any operation are infection. And if you get infection in the wound, that can be disastrous. Usually it's treated with antibiotics and goes away of its own accord with some simple antibiotics. The next problem is if you can't repair the nerve primarily, you have to use various techniques like borrow a nerve from somewhere else, like from your just above your ankle, or elsewhere in the body, and that's very much more a specialist thing that plastic surgeons would do, and that's not something that I can offer. The other problem is if the nerve is under tension when it's repaired, and straightening your fingers causes the nerve repair to gap, then that's not going to do either, and that would require a formal plastic surgeon as well. And they have the ability to use a microscope and do all sorts of things that I can't do at this stage. So the wound itself will obviously be closed primarily with stitches, and that will heal within the first 1 to 2 weeks. The nerve itself, unfortunately, can take a long time to heal, depending on the injury that you've had and the bed that the nerve is sitting in and how damaged that is and how much scar tissue is around. The nerve will usually regenerate after about a month's delay. It will regenerate at approximately 1 millimeter a day. So if you have 5-6 centimeters of nerve to repair, that will be 50 to 60 days.